thank you so much for inviting me to this beautiful facility. This is the, second time, because I came here once to talk to Jenna and get these talks set up. So I'm going to be frequenting this luncheon with different topics. So if there's a topic that you'd like to learn more about, I'd love to hear about it. So my name is Beth Perry. I'm from Wellness 360 Physical Therapy and Massage Therapy. So Wellness 360 came about, my business partner and I wanted to offer more to our physical therapy patients. We wanted to offer more full wellness. We wanted to do more with massage therapy. We give talks on nutrition, kind of your whole circle wellness, which is where 360 came from. So today we're going to talk a little bit about balance and fall prevention, and we're going to talk a little bit about the exercise portion of balance and fall prevention. So I'm going to give you some great exercises. I can answer any questions that you may have, so right now we're going to go ahead and start and talk about balance. Does anybody know, and maybe ladies, you've been taking the class, does anybody know what are 3 things important in keeping your balance? Yes. That's not one of the 3 main ones, though. Ears, yes. So, eyesight. How many of you wear glasses or contacts, need reading glasses? So, eyesight. When it starts to go, your balance starts to go. Hearing. Number 2 is hearing. When your hearing starts to go, your balance starts to go. And number 3 is a little something called proprioception. What proprioception is, and there's good news, there's no quiz after this class, all right? So you don't have to remember what these fancy words are. So proprioception is the nerves in your body that tell you where you are in space. So if I were to close my eyes right here, I would know my arms are out to the side. Same thing with your legs. The proprioceptors tell you where you are in space. Has anyone ever suffered from sciatica or neuropathy or anything of those? Well, there's number 3. Yeah? So what happens as we age is we have to build core strength and other muscle strength and take classes like the class you're taking now to learn more about being present-minded, being aware of your surroundings, being aware of where you're stepping, when you're stepping, and to keep building strength. And I'll tell you, if you are not purposefully exercising for balance, the chances are you're losing it at just a fast rate. So it's really important. So what I want to give you at the end of this talk is I want you to have a little something to go on, a little cheat sheet or a couple exercises that can help you prevent falls in the future. So strengthening is really, really important. First of all, as you age. Second of all, to continue to be functional. Most of you are here. You're active. You're moving. You know, you want to continue to do the things you love, right? So we need to do exercises accordingly. So exercises according to functionality. So you don't really necessarily need to do a bunch of push-ups, right? That's not something that's going to present you with functional mobility. So what we do at Wellness 360 is we turn our exercise classes into functional mobility. So we work on things that are going to improve things for your day-to-day life. So we're going to start by talking a little bit about posture. All right? So posture. For every inch your head sits forward in space, it adds an extra 10 to 12 pounds to your head. So if you're sitting with forward posture, and you're here, it's adding an extra 40 plus pounds to your body. So what happens, then gravity sets in, and what happens? You tend to fall forward, or you overcorrect and fall backwards. All right, so posture is super important when it comes to balance and fall prevention. So there's a couple exercises on the handout. So everybody got a nice handout. All right? So there's a couple exercises. I'm skipping around a little bit, but there's a couple exercises that are guaranteed to help improve your posture. Now, I have the first one here is called the bird dog. Don't worry, you do not have to get on the ground. I have a modification right there for you. But one thing about getting on the ground is when you stop getting on the ground, you stop getting on the ground, right? You don't do it anymore. Why? Out of fear. Fear that you can't what? Get back up. That's right. Yes. Thank you for your participation. That's awesome. But the problem with fall prevention is chances are at some point in our life we're going to fall, right? How do you get back up? Right? How do you get back up? You too, right? But if you're not strong enough and you're not aware of how to do that, you could be stuck on the ground a while. And I'll tell you, in physical therapy, there has been multiple times that we've treated people that have fallen on the ground and couldn't get up and had to wait for someone to come around to help them. Yeah, it's very scary, isn't it? And let me tell you, I do teach a class for osteoporosis, and I will say that when it comes to falls, if you've fallen before, it significantly increases your risk of falling again. If you're fearful of falling, it significantly increases your rate of falling again. So what our class does and the things that we teach you is how to become more confident and prevent the falls. The more you prevent the falls, the more confidence you have. The more confidence you have, the less you fall. All right, so back to posture. Like I said before, the more forward your posture is, thank you gravity, thank you age, thank you computers, thank you osteoporosis, you know? Those are all the things that pull us forward. The more forward you are, the more apt you are to topple over. So, what you want to do for exercise is strengthen what's called the posterior chain, which is the back muscles. All right, so I have a couple exercises on this sheet, your cheat sheet, for back muscles. And what you're going to do is you're going to find somewhere safe to stand, and you're going to hold on to a table, and you're going to lift the opposite arm and opposite leg. And you're going to lift opposite arm and opposite leg. And you're going to do that maybe 2 sets of 10. If you can make it to the floor, and you can see the picture here of them on all four, you can do the same exercise on the floor. It's the opposite arm and the opposite leg, okay? Number 2, I show it here with elastic bands. If you don't have elastic bands, I'm sure they have them here. If they don't have them here, then you can do it without the bands. But what we want to do is you want to squeeze your shoulder blades together. So if you sit up nice and tall and you squeeze your shoulder blades together. All right, if you have a band in your hands, you can pull the band back and you can release, or pull the band back and you can release. Yes, question? Do it in the corner. Yeah, so that stretches out your pecs. That's really good for stretching out your pecs. Yeah. So what you want to do is squeeze those shoulder blades together behind you, and you want to feel the muscles engage. It's really important to feel the muscles engage when you do that. All right, anybody have any questions about those 2 exercises?
Well,
yes?
I'm not about those 2 exercises, no.
Okay, perfect. All right, so one more thing about posture. Posture is not just good for balance. What I would like everyone to do, hey look, you're carrying yours with you. That's perfect. See how versatile they are? It's wonderful. All right, so there are bands. As you can see, you can shove right down in your purse. It even matches your purse. It's perfect. All right, so. So what we're going to do is I'd like everyone to take a minute, and I'd like for you to sit with exaggerated forward posture. I want you to sit, and I want you to just exaggerate that forward posture. All right, what I'd like for you to do is take a nice deep breath in. How hard is that? It is, isn't it? Now sit up nice and tall on purpose. Take a nice deep breath in. Do you see what happens there? So when you are forward postured, it's hard to breathe. your chest open, it expands the lungs and allows you to breathe. It gives the diaphragm room to move, and it allows you to breathe more freely. So not only are you improving your posture, you're improving your breath. Another amazing thing about your posture is for every inch your head sits forward, I told you it adds weight to your head. 12 pounds for every inch. Those muscles on the back, anyone have chronic back pain? Around the upper to midsection? What happens is those muscles work overtime to keep your body upright. So instead of you working with gravity and standing up nice and tall, you're working against gravity and your muscles are working overtime. So you ever wonder why you're so tired? Sometimes you're just tired. It's because your body is so tired working 24/7 trying to keep you upright in life. So it's definitely beneficial, even if it's the only thing you do, even if it's just that bird dogs and the scapular retractions is what they're called, or the rows. Those are really, really important for you to do to build better posture. So we're skipping around a little bit because I wasn't following my notes. Yes?
This one here with the band, does he give it around?
He does, yep. So the question is, the picture that we have with the band, it is looped around something. So you can loop it around a banister, you can loop it around, if you have a heavy dresser, like the handles on the dresser.
Without it, too.
So if you're gonna, do you mind if I borrow your band really quickly? So if you have a band like this, thank you so much. I didn't even think to bring one for demonstration. All right, you can put it around something and pull. But if you don't have something to put it around, you can do this. And open and close your arms, but you're still squeezing your shoulder blades together. So it's really important to feel the shoulder blades squeezing together. That's where you're going to get this open chest and that improved posture behind. All right, so we're going to talk about, yes?
I have a question. When you do this, does that open up?
So that stretches out your chest, yeah. So we spend so much of our time in this chronic forward posture. We're knitting, we're reading, we're forward with the computer, we're looking down at our iPads, we're driving, everything is forward, forward, forward. So chronically forward posture, I said with computers in existence, I'm never going to lose my job. People are always going to be in pain as long as computers are around. So we're job security there, all right? So the more forward you are, the more these muscles in your chest say, well, we are really tired of holding this contraction of the shoulders forward, so we're just going to make it really tight and keep it there. And next thing you know, you're here, and then you're here, and then you're here, and then you're here. So anything you can do, the stretch that you gave, shoulders behind, just to open up the chest is great. It's not strengthening, but it's stretching up, open the chest. It's still important that you're working the muscles behind. It's all about balance. So if you tighten one area, you got to stretch the other. It's counterbalance. Yeah, so that's a great question. Thank you. And please feel free to open up any questions if you have them. So we're going to move on. So improving your posture is one of those things. Remember, eyesight, hearing, and proprioceptors. Those are the three that are, as we age, they get worse. So we have to pick up other pieces to compensate for those losses. So posture is number one. Number two is just typical strength, core strength. Core strength is so important, and a lot of people, when I say core strength, they think, oh, I have to go do sit-ups or crunches. That is not core strength. If anything, working these muscles right here is just intensifying this motion. We don't need any help getting here, right? So crunches, anyone over the age of 40 should not be doing crunches. Crunches are not healthy for you. If anything, especially if you have an osteoporosis diagnosis, crunches can actually be harmful for you. So it's really important, anything we do at Wellness 360, because we do a lot of group fitness classes for the active adult. We have classes for posture, we have classes for bone health, we have classes for strength, we have tons of classes for Parkinson's. That's another wellness portion that we have for Wellness 360 is once you're discharged from physical therapy, you slide into these classes to keep going with your physical therapy exercises. So core strength is a big thing. We like to do our strength in what's called core, but spine neutral, which means the spine stays neutral. Because the spine is all about stability. It's not about mobility. Yes, you want your spine to move, but more importantly, especially as we age and we get diagnoses like osteoporosis, you want your spine stable. You want it protected. You want it for low back health. You want it to help with your walking and your movements, and you don't want to have chronic back pain. So we want to strengthen the deep muscles called your transverse abdominis muscles. So these muscles are the deeper layers that allow you to stand upright. They allow you to breathe better. They allow you to improve your posture. They also improve your posture. They stabilize your spine. So those muscles can be worked in different types of ways. So one I love, believe it or not, your glutes are part of your core. And it's probably one of the most important core muscles that you have. So one of the things I like to do is called bridging. Now obviously if going on the ground, you could do this lying in the bed. Sometimes the bed is too soft. So you can do it in a chair. And when you do it in a chair, all you're doing is sitting in the chair, pretend I have a chair behind me, and you stand up nice and proud, arms open. Why? Because we're working on posture, right? And then you sit back down. And that's it. You stand up and you sit back down. I like to see people doing them at least 2 sets of 10, because anyone ever gets stuck in a chair before? One day you will. One day you will. And these are functional core strengthening exercises. These are the exercises that you're gonna wanna do to improve your functional mobility at home. So you're gonna sit in the chair, nice, all the way down in your chair. You're gonna stand up nice and tall. You're gonna open up that chest, squeeze the shoulder blades together, and then you're gonna repeat that. All right, if you can make it to the floor, if you choose, you're gonna lie down with your knees bent and you're gonna press your bottom up in the air. If you've taken a Pilates class or a yoga class, this is probably a very familiar exercise to you. But what bridges do, it's also great for bed mobility. Moving around in bed, being able to lift your bum and scoot. So these are all things that transition not only in strengthening the appropriate muscles, but they transfer and transition into your day-to-day life. So core strength, there's a lot of other things we can do. As you can see, I didn't have enough room, but we can actually come back and do another talk on that. But planking does not have to be done on the floor. Planking can be done right on a table. Obviously a table that's sturdy, not a hard table or a folding table, and not one with wheels. So I'm gonna do this very hesitantly up front, but you put your hands on a countertop would be a good choice, and you step your legs back. And what you want to do is you want to tuck your tailbone, you want to pull your belly button in, and you want to push away from the floor. And you're going to hold that, and you're going to feel all of a sudden this muscle all the way around your tummy, all the way to your spine. It's called your transverse abdominis. This is a muscle that we barely use anymore, but it's one of the most important muscles that need to be reactivated. So you can do that through planking on different surfaces. Again, always a safe surface, one that's not mobile, all right? That's very important. You can do it against the wall. Yeah, if you want to go against the wall, hands here, and you step out. And you can hold. Let's see, you can do it on a countertop, you can do it on a chair, as long as the chair is either A, immobile, B, on carpet, or against a wall, because chairs will slide. What happens is we start to use improper form, and our planks look more like this, and you start to push. So it's really important to have your shoulders over your wrist. Shoulders over your wrist, so you're straight up and down and you're not planking and pushing something across the room. So these are all different things. Oh my gosh, I love core strength. I could go on and on, but I won't, because I know you ladies have a class to get to. So core strength is really important when it comes to balance and fall prevention, because the core is what activates when you start to lose your balance. If I go to take a step and I step on a rock and I start to go to the side, This is what pulls me back up. So sometimes we like to just have someone stand on a foam pad, and we like to give them a little shove, a little shove, a little shove in different directions. So you're constantly trying to keep yourself upright, and you're firing all these core muscles to keep yourself to center. Another thing I like to do, I won't sit on the scare, well, I can. Another thing I like to do is sit on the edge of my seat, and I like to have people reach as far as they can and use their core to pull themselves back up. And they reach and use their core to pull themselves back up. So this is another really great thing that you can do. Yes? Can you go up? Yes. So yeah, the question was, can you go up? Absolutely. You can reach up, but focus on the center to pull yourself back up. It's called self-righting. So what you want to do is train those muscles in all directions to pull yourself back up to center. So that when you do start to stumble, your body can pull yourself back up. It's called self-righting. All right? So the last one is balance. Balance is like any other muscle. If you do squats every day, or sit to stands every day, you're going to get strong glutes, right? Balance is the same. Balance exercises work everything from the foot to the ankle, to the knee, to the hips, to the core. Every muscle. I sometimes teach full balance classes, an hour of balance, and you're exhausted, and I don't have you doing a whole lot. Because every muscle is firing. Every muscle is firing up the chain of command. So when it comes to balance exercises, now this is the disclaimer here. Don't ever practice balance alone. Always have someone in the house. And two, always practice balance in a safe place. And my favorite place is a hallway where you can hold on to the wall, bring a chair into the hallway. So if you start to stumble to the left or to the right, you have something to grab a hold of. Or in front of a couch, big sturdy chair in front of a couch. So if you start to stumble, you end up in the couch. Or if you have a countertop with an island behind it or something that you can hold on to both sides. But you want to make sure that you're safe. So any of these exercises from here on out, safety is first. But the key is, in order to change, you have to be challenged. All right, so that can be a little uncomfortable for someone who's had a balance fall. So if you're taking an exercise class and you're leaving like, oh, well, I don't really feel anything, it's probably not changing you. It's good, it keeps you moving. Exercise of any kind is good, but you have to challenge yourself just a little to change. So when it comes to practicing balance, you can start by just standing with your feet close together. So standing with your feet close together, anytime the wider your base, the more balanced you are. So anything you do where you bring your feet close together, it can be really challenging. So my suggestion, I'm going to pull this chair over here. My suggestion to people is 2 hands, feet together. Once you feel comfortable here, and it may be today, it may be tomorrow, it may be in a month. On your comfort level, start with just fingertips. Wobbly is okay. If you're like this, that's actually great. It means your body's working overtime to stabilize and strengthen. It's the falls we don't want, all right? It's the falls we don't want. So once you get fingertips, maybe you lift 1 hand off the chair, maybe you lift 2 hands off the chair, but keep them close. Don't go like, oh, look at me. No, keep them close, all right? And then you start adding some reaches. The reaches might start here, and then they might get a little bit bigger. And when this is easy, then we move on to the next. So the next foot position is tandem, which is heel to toe walk, heel to toe stepping. I'm going to keep the chair to my side just so you can see my feet. This one is tough. This one is really tough. So 2 hands on the chair, pretend the chair's in front of me. 2 hands on the chair, fingertips on the chair. Look, Mom, 1 hand, you know, and then hover. When you feel really confident here, you can add some reaches. All right? You will find that when I say, okay, it's time to switch, You're going to be like, oh my gosh, I can't even do this side, because everybody has a side that's stronger than the other. Everybody. So it's okay. You don't need to email me and say, oh my gosh, my one side is much weaker than the other, what do I do? You do nothing. Just be aware that that's your weak side. So we just do more strengthening, okay? So same thing, 2 hands, fingertips, 1 hand, no hands, reaching. All right? And then we go to the biggie, the single leg. All right? So here's where I like to start people with single leg, toe tap first. I call it the kickstand. Use the kickstand. And then when you get comfortable here and you're to the reaching, then lift. So you can do this in stages. Remember, you just need to be challenged. If you're challenged, you're exactly where you need to be. If your friend is like, oh, I went home, I'm doing what Beth told me, and now I'm at single leg, and you're like, well, I'm still at tandem. That's okay. Everyone works at different levels, and there might be a little fear component there. So, single leg, same thing. 2 hands, fingertips, 1 hand at the reaches. All right? Whenever you get really comfortable here, then we move on. And there's a lot of different ways we can move on. We can add movement to that. We can do clock taps where you're tapping to the side. We can do karaoke's where you're moving and you're crossing your feet. You can do heel-toe walking. So there's a million ways we can challenge your balance, but you have to have the basics. And I am going to be hopefully doing an exercise program. Definitely a couple of the other rec centers, hopefully around Point will pick it up. But we're going to be learning that. We're going to be starting with the basics. We're going to be starting feet together, tandem, single leg. We're going to get really comfortable there, and then you move on to some of the other things. Does anybody have any questions about what we've talked about so far? Because I can start the recap once we're done. Nobody? Easy crowd. I like it.
So do you do this outside of here?
Yes, yes. So Wellness 360 has been, it's about 1.5 years old. My business partner, Lindsay, and I both had the same vision of we wanted more than just physical therapy treatment. So we started developing classes. We became certified in different areas. So we do a lot of classes in the area. We teach, as of right now, probably over 20 classes a week in the community. So we have classes that are in our Wellness 360 location in Webster. We also have a Wellness 360 in the city. So we have 2 locations, one in the city and one in Webster. We teach classes out of the Ontario Community Center, out of the Webster Community Center, a couple in our gym. Yes, they're all during the day. They're all during the day. Yeah. Can't come during the day? Yeah, fortunately it is during the day. Yeah, yeah.
Do you ever go to a gym?
I haven't, but I'm not opposed. Yeah, I haven't, but yeah, we can definitely talk about that, sure. So just on that note, the information that you have in front of you, you have the Wellness 360 flyer. It's a little bit about who we are as a company. We do physical therapy, we do massage therapy, we do group fitness classes for disease management, we do community talks for free. We do a lot of, so we can do talks just about anywhere. If you have a church or a program you'd like us to come and give talks on, we can talk about just about anything health and wellness. So if there's something, I think the next talk I have here is on neck pain, exercises for neck pain. So that'll be the next time that I come here. So when is that? Caught me on a good question. Let me look at that later. I'll give you the date in a minute. Dates don't stick. I'm so many places. I want to make sure I give you the right date. So I'll check out my phone when we're done here. Yeah, so we'll be giving lots of talks. We'll be coming monthly here to the Irondequoit Community Center, and hopefully by next season, we'll be able to get some programs established here with all of you. So the next one is the exercises, your exercise cheat sheet. So give you a little bit of things that you can do on your own in a safe place, but remember you need to be challenged. Challenged, but safe. And then the last one is a caregiver's flyer, if you are a caregiver or you know a caregiver, make sure you scan that. There is a form that you can fill out on our special events page. In the month of November, Wellness 360 is giving back to the community by celebrating our caregivers. So we will be doing all kinds of raffles, all kinds of prizes, all kinds of respite events. We have all kinds of things planned, and the good news about this, it's 100% free. Everything. The only thing you'll get is an email letting you know about our caregivers events. So you're welcome to look at our website, and you have to fill out a form just to put your name on the list of the free giveaways. But that's the way we want to give back, is to support those who support without complaint. To support, caregivers support people all day long, 24 hours a day, 7 days a week. So we want to celebrate them, because without them, where would we be as a community? So I'll do a really quick recap on what we learned today. Balance, super important. If you are not working on balance, you're losing balance. There's very specific things that we need to do to gain our balance. Remember, our eyesight, our hearing, and our proprioceptors, when they start to go, our body has to compensate. So there's a lot of other things. I'm just dealing with the exercise portion. There's things about present-minded thinking, being aware, taking a pause if you stand up. Pause, make sure you're balanced before you take a step. Most falls happen not because you're paying attention, right? Most falls happen because you go to take a step, the doorbell rings, and you stumble over a cat toy, or the rug jumps up underneath you. So there's a lot of other things that you can do, but we're specifically talking about balance today. So exercises, we want to improve your posture. We want to improve your posture through strengthening and stretching exercises. We want to get you upright so you can breathe better, you can stand taller, and we can improve your fall risk. All right, we want to work on strength. And strength comes in many forms, but we really want to specifically work on your core strength, because that's going to A, work on your posture, B, help you with low back pain, who doesn't need that, and C, going to help you stay balanced, help you with the self-righting. And you can do that through the sit-to-stands or the bridges, which is one great way. We talked about a couple other things that you can do, and we can go in more detail about that if you have questions. And last but not least, we want to work on, my brain just went, on the actual balance portion. You want to put yourself in balanced, compromised positions in a safe place to work the muscles that help you self-right, that work the muscles that help you gain your balance. So with having said all that, exercise is great, but there's specific exercises you need to do to help you with the balance and fall prevention. Does anyone have any questions about that? No? You guys have been lovely. I appreciate your time. I hope that you picked up at least one thing out of the talk today. And next time, I'll get you the date. Next time I come back, it will be talking about how to prevent neck pain through exercise, because there's a lot of things we can do about that. And everything we talk about, to be honest with you, when it comes to exercise and aging, everything we talk about is going to have posture, it's going to have core strength, and it's going to have balance in it, because those are the most important things, not just for balance, for bone health, for functionality, for chronic pain management. Those are the things that are going to help you the best through life. So if you're going to focus on anything, focus on the things that are going to really matter to your future, because a fall could prevent you from having a future, or enjoying your future. So the insurance company covers physical therapy. Everything else we have is in a very affordable cash base. So our classes range anywhere from $15 to $18 a piece. But if you look at how much you pay for one-time group fitness pop-ins, or if you look at gym memberships, or if you look, look at a copay, which is sometimes $40 a piece. So 15 if you buy in a 10-pack, and we have classes all over the community. We're in Webster. Yeah, so we're in Webster. We have a PT clinic in the city, but our group fitness classes, which the most appropriate for you all would be our 360 intermediate class. That's the one that I teach. I teach it on Tuesdays and Thursdays. I can't give you a card yet. So those are Tuesdays and Thursdays, and they focus on, let me guess, posture, balance, and core strength. That's what that class focuses on. So we have a group of ladies that are absolutely fabulous. It's a small group. We only allow 10. It's all we can fit in our room. They're absolutely lovely, and to be honest, half the time they're not coming to see me, they're coming because they want to see how so-and-so's husband's doing, or, you know, they come. I have a 10-year-old, I tell lots of really great stories about my 10-year-old, so they just can't wait to hear the next story. My son is quite a pleasure. Some of the things he says is pretty hysterical, so we really have a good time in that class, we really do. And yes, question?
Where is the Webster Community Center?
So the Webster Community Center is on Chiota Drive.
Where?
Chiota Drive, it's where, is it Xerox? I'm not from the area, I'm from West Virginia, if you haven't caught it yet. So, yeah.
Farther out from Webster.
So it's right off of 250, when you get off the 250 exit. And we are, so the Webster Rec Center, we do a lot of programs out of there, we do a lot of talks out of there. But we are located on Ridge, so in the village. We're in the village. Yeah. And then university is where our PT clinic is for. We don't have any classes yet out of our Rochester one. We just do PT out of the Rochester one. All right? Yeah. Yeah. Anybody else have any questions? All right. Well, I thank you all so much for joining me. Thank you so much for entertaining me for the last 45 minutes. I appreciate it. And I will be back. I'll get you a date next month, and we'll be talking about neck pain and posture. All right? Thank you so much.